Welcome to part 2 of the Qualitative Methods chapter, chapter 5. I'm going to keep using the same extended example that I used in the last video about qualitative methods, which is this ethnography that I did of a cancer clinic that took care of older people who had a cancer diagnosis and had an interdisciplinary team that took care of the patients. Okay, so ethnography is both a specific set of methods and a larger sort of philosophical approach to how to do qualitative research, but it's mostly about immersion into a particular setting, right? My example is usually healthcare, but it could be into anything. Could be into a sports team, could be into a restaurant, could be into a area of the library where people are hanging out or doing work, could be the Chappelle Lounge, the MCC, all kinds of cool places. Okay, so when you're immersed, you pay a lot of attention to dialogue, both you're talking with your participants and them talking amongst each other. Secondly, nonverbal cues, gestures, facial expressions, eye contact, body posture, all that. Third, the setting. What does the actual setting and context of the interactions look like? And what kind of furniture, what kind of temperature? Does it smell funny in there? I hate the smell of hospitals. Fourth, what are people's appearance? What are they wearing, right? How can you tell who's a doctor or who's a nurse? What kind of outfits are people wearing? How do they do their hair? What race do people seem to be? What genders are represented? All that kind of stuff. Now, there's an observation continuum in terms of how involved in your setting and you do ethnography. And usually these are more middle ground, but there are both ends of the continuum. At one end of the continuum is the complete observer. And this is what's called the etic, ETIC perspective, or the outsider perspective. It's a fresh perspective, right? So that's good. You may notice things anew that other people take for granted, but you also may miss some of the meanings because you don't know the group and the culture as well. Complete observers just sit and try very much. I mean, their presence does affect the world. It does affect the setting, but they try to minimize that as much as possible. They try not to interact with people. They're just completely observing. At the other end of that continuum is the complete participant, which is often called the emic, E-M-I-C, the emic perspective. And that's the insider view. So if you're on the soccer team, men's soccer team, and you're studying the men's soccer team, then you would have an emic perspective. If you are a professor and you want to study other professors, that would give you an emic perspective. If you have a learning disability, you want to study other students with learning disabilities and their communication about that learning disability, then you would have an emic perspective. You already have a very in-depth understanding, but you may therefore not notice a lot of things because you just take them for granted as normal, sort of the opposite of the complete observer. Most of us are somewhere in the middle. An observer who does a little bit of participation, or participation who's doing most of the time they're observing. It's not usually one or the other. It's a middle ground, and that's very much where I am. I try to be a participant as an observer, but nobody wants me doing any healthcare, right? I was getting like people water and blankets if they were too cold from the air conditioning, and passing notes for people and that kind of errandy stuff. Nobody wants me actually doing any healthcare as a participant. But I'd been there so long that I wasn't just observing, I was also talking with them and really knew the setting. Okay, covert research is which is undercover, right? It's absolutely perfectly legal for you to sit at a bus stop and just make notes on who comes and goes, right? Or to sit in the Benson cafeteria and eat and make notes on who's coming and going. You have every right to be there, and you're not putting down people's names, so you're not please don't do that, right? So you're not invading anybody's privacy. However, some people actually get a job at a restaurant in order to do an expose of it. Or there was a journalism study, but it's a similar thing where somebody went to a sorority and then exposed all the things that they do in that particular sorority. After really joining it and pretending that they wanted to be part of it, they then wrote a book about being part of it. For our purposes, that's not ethical. On the other hand, even you're overt or open, the at least the people in charge have given you permission to be there. It's not, depending on the setting, it's not practical for you to be constantly, every time somebody walks in, asking if you can have permission, because you would do nothing but do that, right, in a busy setting. But you try to be overt, definitely, with the people who have given permission at least. Okay. What do we gather when we gather qualitative data? We get all kinds of stories from talking to people, from interviewing them, from doing ethnography with them. We generate field notes. Those are our detailed notes. We make little notes, short notes, and what are called head notes, a note to yourself to remember something when you're in the field, but then you go out of it, go back home and type up as much as you can possibly remember. We also do focus groups, right? Small groups of people talking about a particular issue, also called a group interview. And our samples are not at all based on probability. They're based on a particular condition or identity or thing that we want to study. So it's about being a purposive sample, meaning on purpose, and it's about relevance, not representativeness. So I'm trying to find people who are long-term cancer survivors, people who've survived more than 5 years past a cancer diagnosis, or I'm trying to find people who are athletes in a particular type of sport environment, right? Or people who have children with disabilities. Whatever it is, it's done on purpose. It's not any kind of randomized thing, and it tends to be, therefore, fairly small samples. Okay, what are the strengths of qualitative research? There's a lot of them. And again, it's about depth. It's about appreciating this is actually pretty complicated, things that cannot be separated out into variables. With the teams that I studied, there's lots of people who measured, is there a team? And if so, what kind of good patient outcomes happen? Like, are they less likely to be hospitalized repeatedly? Are they less likely to have other what are called comorbidities, or other kinds of things that they are sick with at the same time? And that's really good, but it doesn't tell you what the interdisciplinary team is actually doing, how they're communicating, or how you're getting those outcomes. So you get the depth and the complexity. Secondly, you can discover new things people have never noticed, right? And then be able to prompt quantitative research and qualitative researchers both to study them. Doing qualitative research can lead to new theories of behavior, right? That really intense observation can really spark ideas, explanations, right? An idea of how things work. You're also getting a chance to observe what people are actually doing rather than just relying on their report of, hey, let me tell you what I do. Both of them are very valuable, but they give you different perspectives on the issue. And it's not that your observations are right and their self-report is wrong, right? It's that you both are bringing a different perspective to what quote unquote what happened, right? And then lastly, we get to have participants tell their own stories in their own language, in their own words, and that's really important, rather than having it all mediated through the language of a survey, right, which was all written by the researcher. Okay, there are, of course, though, a lot of limitations as well to qualitative research. The quality of data really vastly varies, right? It depends on how good that research instrument is doing, and definitely you're always learning to be a better ethnographer or a better interviewer. You can't generalize the stuff. It has implications, it has useful information for other healthcare teams, but you can't generalize and say this is how all healthcare teams are. Can't establish causality, right? I can't say because the team was there, this happened. I can just say, here's cool stuff that the team is doing that I think is really valuable. And they do have these outcomes, right? And I'm saying that this is my explanation, this is my theory of how they got there. But I can't claim that it definitely caused it. And then lastly, ethnography is really time consuming and extremely emotionally tiring. And I'm not whining, I'm just saying it really is. You get to know people, and one of the things about studying people with cancer or people who've had dialysis, I studied a dialysis clinic for quite a while, and they die. The patients die, which is heartbreaking. So I actually went and studied aunties and nieces and nephews and extended families and chosen families networks for a while because I was just so heartbroken about how many of my patients had died. It's very time consuming, and the amount of emotional labor involved is real.